My name is Gabby Thomas, and this is my I am speech. There are many ways I would describe myself. My most rewarding way is being a healthcare worker. I was 19 years old when I went to Midwest Technical Institute to get my phlebotomy certification because I was worried I was not going to like the health field. For me, it was the quickest and cheapest way to try it out. I ended up loving it and decided it was time to further my education. I went to school to be a certified medical assistant, which was a more fitting job for me. Now I am on my way to nursing school, and I could not feel better about what I have chosen to do for my career. In my time working in healthcare, I have worked at a couple different places that are all very different from each other. Starting off, I worked in an assisted living facility. I worked as an inpatient phlebotomist, and I have worked 2 different places in a doctor's office. Today I'm going to talk about working as a phlebotomist and a CMA in the doctor's office. As a phlebotomist, I would draw blood every day. I worked in a very large hospital, which most of us know as OSF St. Francis in Peoria. As a CMA, I worked in 2 different offices. The first office I worked at was an office that had pediatric patients, internal med, which is basically a family practice, and they had an OBGYN side. I now work at family practice. Before we get into what I did and what I do now, I'm going to give you guys a couple fun facts. According to facts.net, with 20 million employees and over 1 trillion in annual payroll, healthcare is the nation's top employer. The second fact is that your fingernails are much more than just nails. They can tell you all sorts of things about your body, such as if they are white, it can indicate liver problems, diabetes, or congestive heart failure. If they are blue, it could mean low oxygen levels, and if they have dark lines or spots, you need to get checked for skin cancer. Working as a phlebotomist was one of my favorite jobs. Phlebotomy is like a challenge, especially if you are working inpatient. There are people in the hospital that could have been there for a very long time and have been poked over and over again. When I worked at the hospital, I did all the blood tests you can think of. On an average day, working as a phlebotomist at OSF St. Francis, we were split into groups covering 13 floors in 3 different buildings. We would draw anywhere from 50 to 100 patients a day. We also worked 12-hour shifts. These are some of the needles. This is a straight stick, that's a butterfly, and those are like the tubes you use to draw blood. And then this is some of the equipment you need to draw blood. So you put your gloves on, tie the tourniquet, find your vein, wipe it off with alcohol, and then stick it with either needle. And then those are the tubes, and then you put a Band-Aid on it afterwards. And then this is the order of draw. So you draw your blood cultures first, and then it'd be light blue, red, gold, green, lavender, pink, and gray, and they all test for different things and have different additives in them. When I was working as a CMA, I loved working with the babies and the children in my first job, but I like the office environment I work in now better. At the first place I worked at, I mainly worked in the pediatric unit where I learned how to do things that no one likes doing that I didn't think I would ever be able to do. Some of those things are giving kids anywhere from 4 days old to 18 years old vaccines, doing rectal temps, assisting as a chaperone for physical exams, and just about anything you can think of. Now I work in a much better environment, and I also do new things that I didn't do in my first job as a CMA. I now help with assisting in small office procedures such as shaved biopsies, bunch procedures, joint injections, and I also do EKGs, and I still get to draw blood. This is like an EKG machine. This is a shaved biopsy. That's a temperature thermometer. That's like a knee injection, and then this is like a vaccine. Working in healthcare will always be rewarding, and I will continue to further my education to further my patient care.